Hello guys, good morning. Good morning everyone. So this is the part 2 in continuation of the INSET most expected questions of the ophthalmology. We are doing part 2 of this, and I hope guys that as the yesterday session, this session will also be very fruitful for you. So just waiting for a couple of seconds so that everybody can join in. I'm just waiting for a couple of session, so that couple of the minutes so that everybody can join in the session. And please let me know if my audio and video is clear for all of you. Did you watch the yesterday's session? If you have not watched it till now, you can already see that session, guys. Right? So I have taken those questions in this session which are so many, they have filled my chat box and there were so many doubts about it. So I thought that we'll take those questions also, and out of those questions which are important too, right? So let's get started, guys. If my audio and video are good enough, please let me know if my audio and video is clear. So again, with the same quote, always aim higher, guys. Shoot for the moon. Even if you miss, you will land among stars. So it is all clear. Hello, everyone. Good morning. So first of all, this question, there have been a lot of doubts about this question. This was a recent NEET PG question, but there are chances that this question is repeated in your INSET paper. That is why this is important for your INSET examination also. This test is called as the Worth 4 dot test. This is called as the Worth 4 dot test, and whenever we are doing this kind of test, you can see we are able to see these 4 dots. That is why it is called as the Worth 4 dot test. And what are the 4 dots that you can see, and what is the name of these goggles? That is also important. First of all, it is used for testing of binocular single vision. Like titmus fly test, you guys already know titmus fly test is used for the stereopsis. This Worth 4 dot test is used to check the binocular single vision. Binocular single vision. And the goggles that we are using are the diplopia goggles. The goggles that we are using are the diplopia goggles. And whenever we are doing this test, the 4 dots that you are able to see, can you see this? One red, it is one red, two green and one white. Okay, so based on this we have to do the interpretation. Now the interpretation depends upon these diplopia goggles, where we have a right eye goggle and the left eye. Right eye may we have red color and left eye may we have the green color. If you concentrate on the goggle, see, so this is fixed, we cannot interchange it. Right eye may red color hai, left eye may green color, that will always remain fixed. So based on this, now if the patient is seeing all 4 dots, okay, all the 4 lights, all 4 dots without any abnormal deviation, without the squint. So if he is able to see all the 4 dots, which 4, one red, two green, one white, he is seeing all the 4 dots, there is no squint, there is no abnormal ocular deviation, I would say it is a normal retinal correspondence along with the binocular single vision. So binocular single vision to hai hi, but along with this the retinal correspondence is also normal. While the other option is that you are seeing all 4 dots, all 4 dots with squint. So if I am seeing all the 4 dots with squint, then it is binocular single vision along with abnormal retinal correspondence. Can you see the difference between the two? Both are binocular single vision. If it is without the squint, it is normal retinal correspondence. If it is with squint, it is abnormal retinal correspondence. Now the option number 3, when you are seeing 3 green, as given in this paper, 3 green. Now forget about the number, just remember green is seen in front of the left eye. That is why it will be a case of right eye suppression. Therefore, it would be a case of right eye suppression. On the other hand, if I am taking 2 red hai, so that is seen in the right eye, therefore it's a left eye suppression. Therefore it's a left eye suppression. And the fourth one is that we are having the 5 lights. If we are able to see the 5 lights, we have 3 green plus 2 red, then it is called as the diplopia. Now forget about the 3 green and 2 red. See, we are seeing one extra light. Normal was 4. That is why it is a case of diplopia. And therefore, because they have given you 3 green they have given, that is why the answer will be the right eye suppression. It's very, very simple. These are all the possible interpretations that can be there in this test. It is a test of binocular single vision, the goggles that we are using, normal retinal correspondence, abnormal retinal correspondence, then the eye suppression along with the diplopia. These can be there, right? Now this question have been asked by so many people, and recently I had also shared this question in the Telegram quiz. Now those of you are watching my session for the first time, welcome to the ophthalmology world, guys. Here we have a Telegram group also where we have 64K students, and daily we are conducting quiz at 10 p.m. The schedule of this Telegram quiz has already been given in the Telegram group link. I'll be sharing. Somebody can please share the Telegram group link. You can join this group, and daily when we are giving the quiz, explanations are given along with it. And afterwards, if any question is still a problem, then we are sharing the explanation also. What is the purpose of the word for dot test? So Saad, in the very first line I told you, it is a binocular single vision. It is used for testing whether the patient has the binocular single vision or not. And binocular single vision means both eyes should have the vision. If only one eye is having vision, another is suppressed, then you cannot have the binocular single vision. So the link of the Telegram group I have shared here, and I will also pin that. Okay, I have even pinned that message. You can see, you can join that group and be a part of this Telegram quiz. Now see this question, they are saying that they are giving you a retinoscopic finding where -2 is at the 90 degree. So see very carefully, 90 degree pe we have -2, and 180 degree pe we have -4. We have -4. That means it could be something like this, -2 here, and 180 pe it is -4. Okay, can you tell me what is the type of astigmatism? So there are multiple kind of questions which could be asked here. First of all, you can see that we are having the different power with the same sign. Different power here with the same signs. Therefore, it is compound astigmatism. Both are minus. Therefore, compound myopic. Therefore, it is compound myopic astigmatism. With the rule or against the rule? More the minus sign, more is the power. Therefore, -4 has more power, and therefore it is against the rule. So first of all, this is the type of astigmatism that is present. Now you have to find out the refractive error. Now what is the formula of refractive error? Refractive error is equal to the retinoscopy. Retinoscopic finding, you have to take minus the tonus and minus the distance factor. Distance factor क्या है? Distance factor is actually 1 upon the distance. Distance factor is simply 1 upon distance, and this distance should be in meter. Tonus is of the mydriatics and the cycloplegics, but here they have not given any mydriatic and cycloplegic, so you have to take just the retinoscopy minus the distance factor. Distance is given as the 1 meter, so your distance factor is 1 upon 1, that will be equal to 1 here. right? So retinoscopy kitna hai? Retinoscopy here is -2 and -4, and you have to subtract -1 from both the sides. So that will give me -3 and -5. That will give me -3 and -5. Now see carefully how to find out the refractive error. You have to consider one as diopter spherical and one as a diopter cylinder. One as the diopter spherical and one as the diopter cylinder we have to take here. And because we are taking 3 as the diopter spherical, right? We are taking 3 as a diopter spherical, so it will be -3 diopter spherical. And we have to subtract for the cylindrical value, you have to subtract the spherical value from this, so you are left with -2 diopter cylinder. Therefore, you are left with -2 diopter cylinder. Are you getting this? Are you getting this? -3 and -2 is there. And now the thing is that because they are giving it because they are giving it like this, so what you have to do, this diopter cylinder is 180 degree, so you have to take at this degree only, therefore this is at 180 degree. Okay, so your answer will be -3 diopter spherical and -2 diopter cylinder at 180 degree. You can see the options. Option number 1 itself, option number 1 itself is correct. We are having -3 diopter spherical and -2 diopter cylinder at the 90 degree. Why 90 degree? Because the power of the cylinder will always act at a perpendicular axis. So when we are giving at 180, it will act at 90 degree, and therefore the answer will be -3. -3 Acha, they have not given the right answer. I think it should be -3 and -3 diopter spherical and -2 diopter cylinder at 90 degree. This will become your right answer. So first of all, you have to go in a very systematic manner. You have to go within a systematic manner. First, you have to take it as a diopter spherical. One power you are taking as diopter spherical, another power you are taking as diopter cylinder. Now, once you have given -3 as diopter spherical, -3 will start acting at both the sides, and therefore we will have to subtract. The power of cylinder is always given at perpendicular axis. So here it is at 180. Therefore, I will have to give it at the 90 degree, and that is why the answer will become -3 diopter spherical and -2 diopter cylinder at 90 degree. Right. Now coming to another important question. This is another question, guys, which is always asked, whether it's a NEET PG paper or it's an INICET paper. They are always asking this. This patient is having the history of diabetes and hypertension, and we are doing FFA. Now, how to evaluate the FFA? So first of all, telling you the basic things that you should look. First of all, the choroid. Choroid is the background that will be looking as gray color. The reason is that the fluorescein particles are very small, so they will not retain in choroid. You will not get the white color, you are getting gray color, and over this you are having the retinal hemorrhages. Retinal hemorrhages may the blood will go, dye will go, and therefore they will appear white. White is your hyperfluorescent. White is the hyperfluorescent, and these can be dots, they can be blots depending upon the size of the hemorrhage. This was also asked recently in a set November 2024, that how the microaneurysms will appear. They will appear as a they will appear as a hyperfluorescent dots. And if you have the neovascularization, if we have the neovascularization, that will appear as a large white area. That will appear as a large white area. And finally, we can have the black color. Black stands for the ischemia. Black will stand for ischemia, no blood, no dye, therefore ischemia. And number 5, you should know that distance. Number 5, that you should know that the distance between the center of macula, between the center of the macula and the fovea is also fixed. That is the 2 disc diameter. 2 disc diameter is 2 into 1.5. That will give me 3 mm. 2 disc diameter or 3 mm. Now based on this, if you see here, this kind. So you can see the background gray is a choroid. You can see these whitish are the hemorrhages. Then this is the optic disc. Now optic disc say 2 disc diameter if I am going. So I am reaching the center of the macula. Therefore this area is macula, and black means ischemia. So what we are having, therefore what we are having is a macular ischemia. You can call it as ischemic maculopathy. You can call it as macular ischemia. When ischemia is there, you will have neovascularization. So even I can call it as a PDR also. Whatever is given in the option, it can be macular ischemia, ischemic maculopathy, or the PDR. We have lot of neovascularization, lacy pattern is there, lot many areas of ischemia is there, especially in the macular area. So this was about the FFA. And another star question for your 2025 will be retinitis pigmentosa, because there were so many questions on retinitis pigmentosa in 2024. So the typical picture you can see, we are having here the pale yellow waxy optic disc is there. We have the pigmentary spicules in the periphery is also there. We are having the arteriolar attenuation. This is the typical triad. So that means it can be a case of RP. Diminution of night vision, night blindness is also there. So you are sure that it's a case of retinitis pigmentosa. Now talking about some of the important things about the RP, it is hereditary. It is hereditary pigmentary dystrophy. It is hereditary pigmentary dystrophy of the photoreceptors. So it is affecting both the photoreceptors, rods as well as cones, and rods are affected earlier than the cones. Because rods are affected earlier, therefore you are going to have the night blindness in the patient. That would be the most important complaint, the earliest complaint. And because night blindness is the earliest, therefore the answer to this question, what is wrong here? They are saying which of the following is a false statement. So false statement will be that night blindness is a late feature. It cannot be a late feature, rather it would be an early feature. We are having the pigmentary spicules, or of the periphery is gone, therefore you will have the lately loss of peripheral vision. That is why we will also have the ring shaped scotoma in this patient. Ring shaped scotoma is there in this patient. Tunnel vision, whatever vision is left in the center, that will be called as tunnel vision. Peripheral vision loss will be there, and it's a most common rod and cone dystrophy is there. And ERG is the investigation of choice. So if I talk about the confirmation, how you can do the confirmation, that is done by the ERG. ERG may we have the uh, three waves: A wave, B wave, and the C wave. Now, A wave is coming from the rods and cones. B wave is coming from the bipolar cell activity. Bipolar cells key activity is there. And C may we have the RPE activity. So it's a pigmentary dystrophy. Bipolar cells are also affected here, because first order neurons are rods and cones. Now when first order neurons are affected, definitely it will affect the second order also. It's a pigmentary dystrophy, therefore it will affect the C wave also. So that is the reason that both A, B, C wave, all the three waves will show the decreased amplitude, right? And no, don't forget to remember the systemic associations also of retinitis pigmentosa. Ocular associations में cystoid macular edema can be there, keratoconus can be there, and very very important systemic association is the Lawrence-Moon-Biddle syndrome. Lawrence-Moon-Biddle syndrome, right? Then which of the following is not a feature of pterygium? Pterygium is a simple topic, but again an important topic, and we have seen that in last 2 to 3 years there have been many questions on pterygium. Pterygium is actually a growth. First of all, you have to understand the difference between the pingicula and pterygium. Pingicula is just a discoloration. This is a growth. It's a triangular growth, more common on the nasal side. It's more common on the nasal side. You can see it has three parts. We have the A. The three parts can be A, B, and C. This is A, this is B, and this is C. We have a head, neck, and body. And we have two types of changes. One is hyperplastic changes are also there, and degenerative changes are also there. Hyperplastic changes and degenerative changes. Degeneration is the elastotic type of degeneration that we are getting. So this is also true. We have a head neck, that is also there. Now what is progressive and what is regressive? Progressive, hyperplastic condition, if the hyperplastic changes are more than the degenerative, then I would say it is progressive. Then I would say it is progressive. If the degenerative changes are more than the hyperplastic changes, then I would say it is the regressive. So two kind of the pterygium can be there, and it is symptomatic. It can cause astigmatism because it is compressing the cornea. Rather, this is the most common cause. Most common cause of the diminution of vision in the patients of the pterygium is the astigmatism. We can also have the pupillary obstruction. Pupillary obstruction can also be there. Pupillary obstruction can also cause the diminution of vision, but most common cause remains astigmatism only. Can you tell me what is the type of astigmatism that can occur here? So the type of astigmatism will be with the rule astigmatism. We also have a Stocker's line. We also have the Stocker's line here. This is due to the iron deposition. So, though KF ring is due to copper deposition, Fletcher's rings in keratoconus is also due to the iron deposition. Stocker's line in pterygium is due to iron deposition. Treatment of choice will be the surgical excision. Treatment of choice will be the surgical excision, but the main problem is recurrence 30 to 80%. So this is the important line that will help you in solving this question. So which of the following is not a feature? Answer is simple excision reduces 95% recurrence. Rather, there are up to 80% chances that pterygium will reoccur. So as it is, you should know now what are the different steps that we can take in order to reduce the rate of recurrence. I can reduce by the mitomycin C. I can use the drug like thiotepa. We can take the help of beta radiations also. Take the help of beta radiations. We can use conjunctival autografting as well as the amniotic membrane grafting. So there are so many things that we can do in order to reduce the recurrence, and amongst them best is the amniotic membrane grafting. So if you have any other question, you can please share it with me. These are the Telegram group link as well as Instagram link that you can see. And somebody has posted one more question. If you see this one, similar to what we have discussed, there is a question here. Um so the question that we have shared here, it was a question something like this, and here, so somebody has asked this question, guys. So I think the question is same, but your options are wrong. The answer has to be this only. Answer has to be this only. Please check this. um So ideally it should be -2, and because you know they have given you -3 and -5, है ना? And they are saying that -3 is diapter they have taken this one. So if I take -3 as a diapter -3 diapter then obviously -3 has started working here. So I have to give only -2. Therefore, -2 diopter cylinder we have to give. And where we have to give? We are giving actually at 180. Now if I give at 180, it will not act at 180, so I will have to give at 90 degree. This is the best possible answer which should be there. When I give the -2 at 90 only, then it will act at 180. This is the most correct answer. So this one is there, -3 diopter spherical and -2 diopter cylinder at 90 degree. Now if you are not getting this in the options, so I believe that the options are wrong. Please check your answer and try to do other questions also based on this, and definitely you will get the right answer. Let me try one more question for this. Suppose they are saying that patient ka retinoscopy they have given as suppose they have given +3 and +5. Okay, suppose they have given you this retinoscopy, and we are using atropine, and again distance we are taking 1 meter. So let us practice one more question. Distance they are giving you 1 meter. So what will be the refractive error? Suppose they are asking. So now the refractive error is equal to retinoscopy, which they have given you, retinoscopy finding, and whatever findings they have given, you have to do minus the tonus and minus the distance factor. And we already know that distance factor is equal to 1 upon distance in the meters. 1 upon distance in meters. Therefore, this is equal to 1 upon 1. 1. Okay. And tonus of atropine is also 1. So, -1, -1, -1 and -1. This is what you are getting. Okay. Now +3 -2 is +1, and here you are getting +3. So ultimately I am getting +1 and +3. Right? Now choose one as the diopter spherical and one as diopter cylinder. If I am giving +1 as the diopter spherical, this has already come. So what is left is only +2 diopter cylinder at. Now because this is at 180, so I will have to give at 90 degree. Or other way also you can do, if I am choosing this as diopter spherical, so +3 diopter spherical. Now you have given 2 extra because I require only +1 as the diopter cylinder. We have given +2 extra. So because you have given +2 as a extra one, therefore now it is -2 diopter cylinder, and because I have to give at 90, so I will give at 180 degree. These are the two prescriptions that are possibly given in this patient. Okay. Okay, in which stage surgery we should give to the patient? Are you asking about pterygium? Which stage may means when it is causing significant diminution of vision? It can be due to astigmatism, it can be due to the obstruction of pupil. Collagen cross-linking. Collagen cross-linking is done in cases of keratoconus. When we are doing the collagen cross-linking, we can prevent the progression of the keratoconus. This is given by the what you called as topical riboflavin drops. Akash, you have given the right answer. What is the visual angle of the Worth 4 dot test? Visual angle is not required. Only this much is required. Explain about the phoria and tropia differentiation by investigation. So Akash, that would be a differentiation where we will be doing the test of the squint. There we will be doing the test of the squint, and previously also we have already done one session on the test of the optics and refraction in the squint. Meanwhile you can look at this, and very soon I'll plan another session where we will be discussing all the tests of the squint. Okay. So, yes. Any other question related to these things? Because that will be separately altogether different session where we'll be discussing the test of the squint, how to differentiate between phoria and tropia. First of all, phoria means what? The latent squint. Latent squint is not visible. Manifest squint only is visible. So, you need not differentiate whether it's a phoria or tropia by the test that could be seen. Now, what kind of phoria or what kind of tropia, iso or exo, that will be differentiated. That will be a Maddox rod test. Maddox rod test case so many times I have made the videos and I have taken it. So please look at those videos, right? So thank you so much, guys. Now we have done 2 sessions on the most expected questions in INICET 2025. Hope this will help you in clearing all your doubts, your anxiety and apprehension related to important questions of INICET. And for the other queries, you can always DM me on Telegram, DM on the Insta profile, or group is always there. Thank you so much, guys. Bye bye and happy ophthalmology.